So they are rotating to you, you're stationary, and then you'll have the groups come to you.
Yeah, we'll take a couple of minute break between each round, as I told you. After you do your feedback, and this group will leave, another group will come in and get settled. We'll do that 3 times, and then we're gonna put you on big screen and give feedback to the whole group, and then you're free to go to lunch. Are you in DC?
Yes.
Oh, so you're already at the lunch hour.
Oh, sorry, we're interrupting.
He's on East Coast time. Yeah, no. I lived there for a long time.
I'm from Chesapeake, Virginia Beach area, so kind of close to the Eastern Shore. So
Oh, yeah, not bad at
Okay.
all. I live in Chicago now, very different. Okay, folks, take your seats. Lock this is on, you need another chair.
We do
Bring
need
them around. Careful with the wires. Yeah, somebody can sit around the edge. I want to be able to see all of the wonders of technology. Only thing Guys, ready?
Okay.
Yourself organized, take a deep breath.
Hi,
You may begin the meeting.
hi, my name is Angela Richardson. I'm from Birmingham, Alabama, and we want to talk to you today about the home and community-based services. Wage services, but they better known as the Better Care, Better Jobs Act that was introduced in earlier this year in January, on January the 26th. It's known as Senate Bill 100, and it was referred to the Finance Committee, and it's identical to the same bill that Representative Dingle introduced in the 117th session.
Hi, my name is Christy Giles. I'm from Washington County. This act has 39 co-sponsors as of now. By passing this act, it would allow enhanced funding for the home and community-based services. It would allow enhanced support, quality and accountability, and it would also help facilitate state planning with public input. And when you're dealing with supports and services for the public, that's very important.
Hi, I'm Chantel Kellogg and I'm from Daphne. And what we want to speak to you about is the home and community-based services waiting list. And we want to eliminate it. It's by making it for all, not just for some. And it's a necessity, not a luxury.
My name is Niles Valentine. I'm from Mobile County. I am an independent living specialist and a fully certified full stack developer. And as someone with a developmental disorder, I had to make a choice between getting all the services that I need or making money and not living in poverty. I believe that no one should ever have to make that choice.
Hi, my name is Audra Broughton. I'm a resident of Mobile County, also an educator. And I would like to know, would you like to meet with someone that can make this look real to you, someone who is in this position? Is there anything else you would like to add or ask us of what we're doing?
So what you mentioned the bill previously, could you repeat that? I think it was Senate Bill 100, correct?
Yes, it's Senate Bill 100, and it's the Better Care, Better Jobs Act
Okay.
by U.S. Senator Bob Casey.
Okay. So, and I know that's a Senate bill. Has there been a House bill introduced yet for the 118th Congress yet?
No, there has not.
Okay. And you said Congresswoman Dingle introduced it in the 117th?
Correct.
Okay. So yeah, I mean, I just didn't know if there's any, because we can't co-sponsor a Senate bill, we can only co-sponsor House bill. So I just didn't know if there's any plans on having that introduced sometime soon, or if there's a timeline on when that would be happening.
Yes, we expect Representative Dingle to introduce it again.
Okay. Okay. And then I think you were mentioning the home and community-based services program. Now, is that through appropriations? does that go through, or is there a particular bill based with that, or is that for just overall funding for that program?
It's a Medicaid.
It's a Medicaid, okay. So, okay,
So the home and community-based service waiver is funded through Medicaid. The state of Alabama has, I believe, 7 waiver service programs as of right now. Each waiver has a different set of criteria, but they help provide people with disabilities with home-based services, community-based services, transportation, respite care, just an array of things that a person living with disabilities would need to be able to live the same type of life that a typical person would live without supports.
so is there and I know you mentioned a waiting list, but is there an overall funding issue with that as well? Or is that just, I mean, I'm assuming there's a funding issue, because if there's a waiting list, then there's not enough funding for it. But is there a particular like increase in funding amount that you were recommending or suggesting?
Yes, there needs to be an increase in funding for this to help eliminate that waiting list.
Okay.
There can be people on the waiting list for years. Specifically, I can tell you about the ID waiting, which is the intellectual disability waiting list, who you have to be 3 years or older to qualify for. But you also have to qualify for Medicaid. In the state of Alabama, they only allow 5,200 people to be on that waiver service at a time, when there are tens of thousands of people waiting on that list. My daughter is included in one of those. We could wait on the list for years. And she's 17. So, services when she gets out of high school is going to come quicker than what getting off the waiting list would.
Okay. Now for the Better Care, Better Jobs Act, I know you mentioned like it was introduced, how many co-sponsors, but what does it actually do?
It would actually enhance the Medicaid funding for the home community-based services. It would also,
Do you know by how much?
by how much?
You said it would enhance funding.
There would be states will be eligible for a permanent 10 percentage point increase in federal Medicaid.
Okay.
And if that answers your question.
Yes. Percent increase in Medicaid.
And so that's one of them. Another one is that it would encourage innovative models that would benefit direct care workers and care recipients, or support workers and support recipients. For those who need support, they would have someone to help them do what they want to do within their communities. And also it would support quality and accountability, because you want people to be able to have the supports they need, but you want them to have the best support that they need so that they can live the best life possible in their circumstances.
So the 10% increase in Medicaid funding, would that come from the federal government or from the states? Because I know sometimes it's split between, or like Medicaid funding can come from the federal government and state, from my understanding, or at least it's administered by the state. But I just wanted to double check on where the funding would come from.
It would be federal. Yes.
It would be federal. Okay. Now I know it's a 10% increase, but is there like a dollar amount listed? No. Okay. Okay.
And there is a shortage also of direct care workers, where you have individuals that want to work, but they don't have the supports to go out into the workforce to be able to carry out the jobs that they want to perform. And so if we want to make sure that they have the support so that they can work.
Like
Like
Yeah.
me and Angela.
Okay.
I've also
Now,
noticed that
go ahead.
I also have noticed that in the field of direct care professionals, they are very much underpaid. it's hard to even find people who are qualified because in a very catch-22 fashion, it doesn't pay well enough.
What is the average pay per hour?
$13 per hour.
$13?
Yes.
To get the people in the community
To
involved, to
Okay.
help.
we're also trying to get more people in the community involved
Mhm.
with this effort as well.
Set up like things where they can make friends and socialize. So they'll have, the people will have a way to have the supports without having to go through this, just to be able to free up some money to help other people. Like he and I have a business where we're encouraging them to meet neurotypical people that want to help and be friends with these individuals, like to give them rides to, maybe classes or doctor's appointments or something. And it enhances their life all the way around. And then you can take that money they were getting and then funnel it into other places. And we can still, that's what we plan to do in Mobile. We're trying to get that started, and that's in Southern Alabama.
Okay.
It was
Yeah.
mentioned that
Okay.
the average wages for a direct care professional was $13. Under my business model, when I proposed to start a direct care professional at $17.50, it was considered a rarity. It was considered a great starting wage. And when she explained that to me, that the average was $13 an hour, I understood why everyone was so blown away by that.
And when we have to get the communities involved to help us, really, and they're willing to. We have people in Mobile that are willing to branch out and help each other. I'm an educator also on the spectrum. He was one of my students, and that's like our vision for our plan. We wanted to get people involved so we can free up more money for people in other areas that may not can do what we can do.
And I also made mention that I was an independent living specialist and a fully certified full stack developer. I am living proof that this method works.
Yes, it does, because he was thought to not be able to do anything.
Gotcha.
Yes, we need to get more people out of institutions and into the community doing something that they love to do. And that will create more love, more communities, just bring people together.
It would also free up a lot more money in the Medicaid system as well to funnel into people who also need to get out of institutions, also need to become more independent. And as those people fade services,
And
then
it can just cycle into more kindness and getting people more involved. Because without that together love and generosity, we can't, this is gonna continue.
The disabled need a purpose. They want to work. It's not that they don't want to work. They need to get out in the community. They like to go shopping. They need to learn how to shop for themselves. They don't need to sit in a wheelchair and parked in front of a window. They need to get out in the community.
And we're proof, neither one of us were thought. I'm an actual educator and I was the worst student you would ever see. And he's one of my students, and we were thought we would be on, I don't know, my family said you would be in an institution, but
Do you
So
have more questions for us?
yeah, I mean, I see that it's I pulled it up from congress.gov and looked at last Congress. I saw that it was introduced June 24th, 2021, and then there was no real legislative activity after that, after it was referred to the health subcommittee, at least from what I can see. I just didn't know if that's one thing I would maybe suggest is finding out why it didn't move anywhere last Congress. Because like I said, normally like when they have bills introduced, they'll have like hearings and markups, and from what I see, I just don't see any legislative activity on it, at least from last Congress. So I would probably try and find out what happened with that bill last Congress, because even on the Senate side, last Congress, it was introduced June 24, 2021, and then there was no real legislative activity. So I would like try and find out what's going or what happened with the bill, because there's normally you can see that there's been a hearing or been referred to certain different subcommittees or been discharged if it's moving through Congress, but no, yeah, like I can definitely take a look at this bill like later on, but yeah, will you be doing these meetings in person? Do you know?
We have the contact.
We can, yes.
Chris.
Yeah, right,
Um,
for the
that is
future.
yeah, I would probably recommend doing in person, just because one, me just trying to like write all this stuff down can be, very quick. And if it's in person, it can be, you can sort of do it on a leave behind, like have a printed piece of paper out so that you can leave with them so they can refer back to it. But no, yeah, other than that, that's no real questions, but yeah, I can give y'all feedback later on after the session. Okay.
Okay.
Thank you so much for your time. We
Thank you.
appreciate it.
And actually,
No problem. I'm glad that, I see, at least some first district residents and, that's always good too, because it's always good to, bring people from the actual districts that show like the impact that it's having on the district. And especially in-person meetings with constituents are a really good way to get a confirmed meeting with the member. So, but no, I'll I can definitely give y'all feedback later on, and I appreciate y'all.
you've already
y'all's
given
time.
them great feedback about
Yeah.
in person. You have a handout. Make sure there are constituents in the meeting. Give them a couple more, and then you can make general to everybody. But for this group, 1 or 2 more points, maybe.
Yeah. So one thing I would start at the beginning of the meeting, you started with introductions and then you kind of talked a little bit about different issues at the beginning. Like you started off with the Better Care, Better Jobs Act. Then you started with the home and community-based services. I would probably start off with introductions, go with everyone and like introduce yourself, what you do, where you're from, and then go into the ask, like co-sponsoring Better Care, Better Jobs Act. Because that way we get the introductions first and, and then I can go back and basically I was just trying to write down the information while y'all were introducing yourselves, and I kind of wanted to at least, so that's one thing I would do. Just start off with the introductions at first, and then maybe go into the Better Care, Better Jobs bill. And then after you finish talking about that, you go into the home and community-based services and why that's important. Because it just kind of felt, jumping around a little bit. But other than that, I would probably, I would just, start off with one issue, start off with focusing on the bill, and then maybe go into the home and community-based services after that. And then,
Okay.
I would also like maybe find out some figures on how many people this would impact in the district, if that's possible. That way you can put it like an actual number of how many people this would impact in the district. But yeah, other than that, I think it was pretty good.
Great. That's very helpful feedback. I want to thank you. Let me give you a tidbit because you're not on Energy and Commerce and Health Subcommittee and all that. When you asked the match ratio and what's it going to cost, the way Medicaid works and has since 1965, and this is what's creating problems on one side of the aisle, is it's an entitlement. So if you pass this bill, CBO can't really estimate it because the state still has to put some money on the table. But if the state said, oh, with that new enhanced match, Alabama is going to get 87 cents on the dollar instead of 77, we're going to add a bunch more people. The federal government still has to come up with that match. So it's open-ended, even though at the state level, they can control it on the waiver. They can't do that on healthcare. They can't do that on nursing homes. But on this waiver authority, the states have total control for whom, how many, and what they're going to put on the table. So that might just be helpful to you and your representative as we get into this, because I think that's the biggest obstacle of why it didn't move in the last Congress. But on your side, Kathy McMorris Rogers, who now chairs House Energy and Commerce, happens to also be very active in the disability community.
Yeah. Mhm.
Parent of a son with Down syndrome. So I think we may see some action in the House, maybe even better than the Senate.
And that is one thing I would probably suggest for this bill is, making it bipartisan, because I don't see any real Republican support. And, I will say that can scare off some members if there's not any real bipartisan solution for it. And like you said, it's Kathy McMorris Rogers, or chairwoman. Like I said, she's chair of the Energy and Commerce Committee, was to come out with some bipartisan compromise for this, that could get a lot of bipartisan support. And that is one thing I would try and especially, like I said, she does have a son with Down syndrome, and she has been very, supportive of that. So that's just my is any time to embrace bipartisan solutions, that's the best way of doing it.
Thank you.
And
Great
that's,
point to end. I want to rotate. Thank you. Take a couple
Yep.
of minutes break. This group is going to leave. We've got the next group ready to come on in. Thank you all. Hope you heard his comments. Okay, next group, come on in. Got a couple of minutes before your meeting will start. Might need another chair, push one around, but you all need to be on this side so he can see you and you can see him. There we go. Okay, great. Let's angle the chairs and everybody will be fine.
Get in there.
Get yourself settled. Take a deep breath. All right. Welcome back.
hey,
All right, ladies and gentlemen, Mr. Ayers. Directors.
Hello, my name is Shanique Jeffers and I'm from Montgomery, Alabama.
Oh, hi. I'm Yoon Kim from Auburn, Alabama. Nice to meet you.
Hello, my name is Maria Gutierrez and I am from Auburn, Alabama. Thank you for being with us.
thank you.
Hi, I'm Emily Bernard from Tuscumbia, Alabama.
Hi, I'm Brandon Crosby from Talladega, Alabama.
Okay.
Hi, I'm Irene Dole from Montgomery, Alabama.
We're here to talk about the Better Care, Better Jobs Act, which is Senate Bill 100. It has not been introduced in the House yet, but Debbie Dingle of Michigan will be introducing it as a companion bill to the House. This act is the home and community-based services, which allows people to remain in their homes, stay active in their communities, and lead independent lives. This will expand access to good quality care and lead to better pay and wages to benefit for the workers.
Okay. Now, what brings y'all here today? I guess, like how are you impacted by this bill?
Well,
If you would allow us,
Yeah,
we
go
would
ahead.
like to share some personal
Sure.
stuff.
Mhm.
Brandon?
Hi, I am Brandon Crosby. I'm 35 years old. I love to sing and be out in my community, and I also have what's called septal optic dysplasia. That's where the midsection of my brain didn't develop, causing my left optic nerve not to develop. so I don't drive. And I work at a thrift store on the weekends, and I have to rely on my sister or my mom to drop me off and pick me up. And I also work for the ARC of North Talladega County. It's a nonprofit organization, and we help people with developmental disabilities advocate for themselves.
Yeah, I'm actually, I believe there's a chapter in Baldwin County, from my understanding. I have to double
Okay.
check. I have to double check. I believe I've reached out to them previously, but yeah, I appreciate you being here. And then I guess if anybody else wants to sort of talk about how they're impacted or how they would be impacted by this bill.
So let me just share my story. So, my daughter is receiving one of the waiver services, and then the case manager came, and then after 6 months, she left the job. And then new manager each time came every month. So 5 to 6 new people. And then whenever they come, I have to explain everything from the beginning about my daughter and then talk about the services. And I had many questions I asked, but they were not really able to answer, and then they were not giving enough resources. So I felt like this bill is about raising the wages of the providers, and then train them and educate them to work this program well. So if the bill passes, then like my daughter's case and his case, the individuals can get like more effective services, and then it is beneficial for individuals, and at the same time it's beneficial, financially beneficial to the community too. So yeah, that's why I'm supporting this bill.
So we know the more active a person is in the community, the more beneficial it is for them physically, mentally, socially. So even though this bill is asking for increased funding, long-term, I think it would benefit everyone financially, because the more active someone can be in the community, they can participate in employment, they're going to have reduced healthcare costs. So it really benefits everybody.
For some people, like my son, he wants to have the opportunity to have competitive employment. He wants to live independent.
So is there a study that supports that? Like, is there like a medical study that shows to positive outcomes? That's one thing I would probably mention. Be like, hey, I'm not sure you're aware that there's a study out there that shows, if with better home-based services, there's a 60% improvement in overall quality of life. Like, if there's a study like that around, I would probably maybe mention that during your pitch. But yeah, that was just wanted to, because I know you mentioned that, but it's always good to follow up with, like hard facts. That's one thing I would, but it's a good point to mention, that's for sure. So, but yeah, sorry, I just wanted to.
Thank you for that suggestion.
Yeah, I mean,
And we're happy to share that data with you, because we are always, there is evidence-based research that is out there that, we will be happy to share that with you guys.
Yeah. Always evidence-based. Like if you can show that it's like hard numbers and facts, and then talk about, like personal stories, that's a good way to sort of, pitch a bill to us, basically. But yeah, sorry, I just wanted to, and I can get some more feedback, but I just didn't know if anybody else wanted to talk about their own personal story or how this would impact them as well.
Well, in our case, my son is 24, and like I said before, he is still living with us, but he wants to be independent. Okay, so when we talked to him, he said, "Why would I want to be receiving SSI when I could have customized competitive employment and be independent? It makes more sense for me to have more money on my check account than
Mhm.
just the same check every month. So this bill will actually help improve the lives of many people with disabilities. And there is that research evidence-based data that will tell us that on the long run, it's going to be a better outcome for these people like Brandon, people like Michelle. Their children will have more opportunities to be fully integrated members of the community.
So you mentioned employment. So how would this actually benefit individual with a developmental disability getting employment?
Right now, there are some people that are receiving supported employment, but there are others that want to be not just working in Publix bagging groceries.
Mhm.
You know, this is not a cookie cutter. And we have to, as a community, have to be reaching out within the local businesses, trying to see and collaborate and work together and give these opportunities for the people working in the city hall. We have to give the opportunities for people with developmental and intellectual disabilities being out there in the community. And yes, some of them might need more support than others, but that is okay. So we really need to be thinking about outside this box where they have thought that people with disabilities are not productive members of society.
And the other implication too is if without that support, then their family members are their caregivers and they cannot work a job either.
So if my son cannot work and I have to stay home, that means that I cannot go and work 40 hours. And so that means that I have to depend on the state and I am not paying taxes.
So that's just my question is like how, from my understanding, this helps them, give support for staying at home and, staying in the community, from my understanding, correct? So what, if they were to get employment, what in this bill would help them, because I had a meeting recently with the National Association of the Blind, and they were talking about how they needed assistive technology to work at some of these places because they might not be able to read certain apps or read certain things. So what in this bill would actually help them maintain employment? I just didn't know what's the link. I know this is kind of like helping more like a home-based services, but is it kind of like a telework thing, or is this kind of is there a telework input? Okay. I just didn't know how this would benefit them or people with developmental disabilities to maintain employment.
It specifically says in the bill that it would improve coordination with housing, transportation, and employment supports. So
Okay.
that is the bill.
Okay. So what is the employment supports part?
Job coaching.
Job coaching? Okay.
Job coaching, they will have someone assist them with their job duty.
Gotcha.
Them accustomed to what they need to do. And so when they have that support, then they're able to get the job that they're able to do. And then the job coaching will eventually fade out, but they need that assistance to start out with.
Okay. That helps me because, I was thinking more of like how it was home care based services, like more like people to help, help stay in the community. Like if you needed help driving to, a grocery store, but weren't able to drive type thing. Like I just didn't know necessarily what the home care based services specifies. It all comes down to the definitions of like what is defined as a home care based services. So definitely kind of talking about what expanding this would entail, like actual hard, pay for, like you said, job coaches and, if there is some people with some other disabilities might need a nurse or somebody to come by and check on someone, especially so that a parent can go to work to have someone still be there. And if the the individual with a disability is like teleworking, like to be there so that the other person, so maybe just talking about what overall, yes, expanding funding for the program is good, but then like what specifically will it be doing type thing?
Great.
And then,
So,
oh, go ahead.
yeah, do you have any other questions for us?
So I would also, okay, so y'all did good about introducing yourselves all at the beginning. You know, and you know, probably like talk about, I know you mentioned like where you're from, maybe like what you do, and maybe talk briefly about how you're impacted at the beginning, like introduce yourself. Hey, my name's Nick, I'm from Mobile, Alabama. I'm currently working like this, and I'm supporting my son or daughter that has a developmental disability. So that way, you know, and then talk about, y'all did good about going straight into, or, you know, talking about the bill at first, talking about the background. I did like that you mentioned ARC, because like that helps me because I've interacted with that organization before. So, and then what else did I? And then, yeah, like I said, oh, that was one thing. You know, don't be afraid to talk, you know, like, you know, if because it was just like very, you know, it's the intros and then talked about the bill, and then it was kind of like silent, and I had to like, you know, kind of ask questions type thing. We want to hear from y'all type thing, you know, so don't be afraid to sort of talk. Of course, you know, focus, you know, you don't want to go left and right and all over the place, but, you know, definitely the intros, talk about how you know, why you're here, and, you know, if it's a mother that has a developmental disability or a family member, and then maybe talk about the bill. Also, if I didn't mention it to the last group, but maybe if there's a way to find out how many constituents in that district have a developmental disability, if there's a way to get that number, you know, or how many, is there a particular, you mentioned the ARC Center, you know, how many ARC centers are there in the state of Alabama type thing, you know, so, but yeah, I think that's about it. I mean, overall good. And then, like I said, just knowing, what, I guess, like expanding funding for the home care based services is, you know, good. Maybe mention how much of an increase it would be. And then just talk about that would be supporting, you know, job coaching, that would be supporting, you know, transportation, housing, like what it would actually do type thing. And then maybe, yeah, and then like I said, just probably, because that is one thing I've noticed, you know, it's just bringing it back to the district is always a good way to approach it. And like I said, you know, don't be afraid to talk. It is always good to probably keep it to 10 to 15 minutes. Just because, especially now, if you are planning on coming to DC to do an in-person meeting, we are back in person. So it's a lot of meetings left and right. You know, the congressmen and women are jumping from committee hearings to a meeting in the hallway to grabbing salad and trying to eat that before they have to jump to another meeting. So keeping it to like 15 minutes is a good way of going about it. Just because you never know if it's going to be a 30-minute meeting or a 15-minute meeting. And but yeah, other than that, it was pretty good.
Good. Thank you.
Thank you.
Appreciate
Thank
it.
you.
We need to rotate. Thank you.
Thank you so very much for your time.
Thank you so much for your time.
Thank
I'll
y'all.
give you a little,
Thank you for the feedback.
Yeah, no problem.
the technical answers. the data are so compelling and have been for decades on when states put in place what this bill would require is accountability for quality of life outcomes. That isn't a requirement today. This bill would require it.
Yeah, and like I said, like especially on a leave behind type thing, like including some of that information is always a good way of going about it. And maybe even printing out that study, be like,
Yeah.
hey, I printed out the summary of this study, and if you want to go back and take a look at it, type thing.
And I'll send you one, because I've got your email, that was done in Iowa, looking at people with disabilities of all kinds, before employment and after employment, done by the University of Iowa, at their Medicaid healthcare costs. Hang on to this one, because I'm going to send it to you. It doesn't get the distribution it needs. In 1 year, $21 million reduction in healthcare costs and mental health costs. As I tell people, work for you and me may be stressful. Non-work is a lot more stressful. So we've got the data. Mathematica has studied money follows the person. Superb research firm. I'm sure you've heard of them. Okay. Every measure of quality of life when people leave a nursing home or an institution is vastly improved, statistically significant. And in addition, costs are down by 40% per person. So again, it's there. That was paid for by the feds. I'll send you a copy, but I'm glad you raised it. I'll make sure people know. We have tons of research data on employment, on people living in the community, all of it. And you're right, that needs to be weaved in. It's not just about more money, which is why the bill talks about accountability for outcomes. And I want to be sure that they stress that to you as well in the future. Thank you. Okay, we'll get the next group in a minute. Part of it's here.
I'll be right back.
Okay, understand. Thank you. They're very good. We're fortunate. Sometimes he knows enough to ask good questions, which is great. Plus, he's heard enough from the other two groups, but he had some general sense. Do your thing.
Oh, you know it. Come this way. Because you got CC. Oh,
I'll go over there.
okay. I'll go around it. You can come right here. Paige.
Okay.
We were trying to move around so you can.
Oh, are you moving?
Yeah,
Thank you.
Yeah, everybody
I
can
just
stay on that side so you can see.
Oh.
You.
Yeah, so they can see.
So if we need to put him on the end, and we can pull this table.
Yeah, he gonna be probably
Bang,
on
yeah.
the end.
Yeah.
Cause she.
Depending on how wide the camera.
Oh,
is Daryl on there?
And then,
I can't see.
He gonna.
Oh, will there be a
We're gonna
lot
have him there.
See you right there.
Okay.
Cause he's right there.
He's gonna be on that big monitor.
Yeah, he's on. He's gonna be right there.
That was an easy.
That's what I was telling her.
Oh, I thought
She was thinking he was gonna be up there.
Okay. We still have to change. No. Nothing more about it. I could have stayed over there, because he could have saw me.
He gonna see you. Yes.
No, when I was over there, I said I could have stayed over there. I'm sorry. You just tried to drag my coat. Stop lying. Hey,
So my big old booty. Oh, hey, Nick.
Hello, how are you?
Because I was talking about my rear end, my rump.
We're sorry. We didn't know you were back.
Broadcasting.
You're good. No, that
Just
you
a
know,
little
starting off the
banter
meeting,
back and forth.
starting off a meeting with a laugh is not a bad way to start. So, but yeah, is everyone here?
Just about, we're almost there. Okay, get yourself settled, ladies and gentlemen. Mr. Ayers is here. You may start your meeting. Whoever's up first.
Well, good morning. Good morning. I'm Yvette Lockett, and my group and I would like to speak to you today about the Better Jobs Act, which is Senate Bill 100. It's being introduced by Senator Bob Casey from Pennsylvania. And actually, Representative Dingell introduced this bill in the 117th Congress. And from our understanding, she'll be introducing it in about 2 weeks. So we'd like to, we'll be giving you some further details, or if you have any questions for me right now, my colleagues will be speaking more in depth about what the bill entails. And we'd like to try to get your support.
Okay, well, yeah, let's go ahead and I guess let everyone go ahead and introduce themselves. And then we can talk about the bill.
Okay, hello, my name is Latanya Snow. And I'm here to talk about the living more independently.
Yeah. And where are y'all from, by the way?
Oh, I'm sorry, from Montgomery, Alabama.
And I do apologize, Yvette again, and I'm from Huntsville, Alabama.
Okay, I've been to Huntsville. You know, it's a, you know, I'm very excited. I can't wait to see what Huntsville looks like in 5 years. It's growing very quickly.
Yeah, they do a lot of things there.
Yeah. I mean,
The rocket won't be there next time you go through. They moved the rocket from the Welcome Center. It's been a big debate in the state.
Right.
Well, yeah, I appreciate both of y'all being here. And now I'll let everyone else introduce themselves.
Okay. I'm Paige Perry and I'm from Birmingham.
Okay.
Did you hear? Can you hear okay?
I didn't quite hear, but
somehow he can scream at an Alabama football game, but then here
Roll Tide.
with a
Roll
congressman's
Tide.
office, and it's CC. His initials are CC. That's what he goes.
Nice to meet you.
He's from Birmingham. So.
Great for you to be here. Thank you.
Good morning. I'm Jennifer Rucker, and I'm from a very small community, Indian Springs Village.
Okay. In Alabama?
In Alabama, yes.
And I am Sharon Henderson, and I am from Opelika, Alabama.
Okay. Well, yeah, I appreciate y'all all being here. Yeah, I just wanted to, you know, like, definitely, you know, let everyone introduce themselves at first, and always, you know, talk about where you're from, city and state. Because I'm actually from Chesapeake, Virginia Beach area, so I've learned a little bit about, you know, I've, you know, been with the Alabama delegation for a year now, but definitely, you know, like I said, it was good, especially small towns. I'm like, okay, is that in Alabama or is that in Georgia?
You talk about possum trot.
But no, yeah, that's just one, you know, feedback I would give is kind of like, you know, it was good that y'all were introducing yourselves, but you know, go around to everyone first and then go into the ask. That's one thing I would probably start off with. But yeah, happy to talk about the Better Care, Better Jobs Act. And I know you said it was Senate Bill 100.
Yes.
And then Senator Casey introduced it, correct?
Yeah.
And then I see that the House version hasn't been introduced yet. And then I'm assuming, you know, you guys are coordinating with, or you've been reaching out to Congresswoman Dingell's office on this bill.
Yes.
Yeah. I just didn't know if there's like any plans on when they would be introducing.
We have
this
been
bill?
told in the next 2 weeks it will be
Okay.
to this Congress.
Okay.
Mhm.
In the next 2 weeks. Okay. Yeah.
And
Well,
it's
that's good.
identical to the Senate bill, but you're
That's good that, you know, because like I think I've asked that at least once already and they weren't quite sure. So I like that you were like in the next 2 weeks, like having, so yeah, if y'all want to talk about, I guess, what the bill would do, you know, that's we can go from there.
We're ready.
Okay.
So,
Sharon, you want to start?
Well, one of the components is direct supports professionals, increasing funding for them, increasing their pay. My son, Dallas, he is 23 years old, special need. He has, we don't actually have a diagnosis for him. We've never had a diagnosis.
Oh, wow.
He has a tracheostomy and he has a G-tube. He's had them since he was 10 years old, and we've had a nurse for him ever since he was 10 years old, except for the last year. And having a nurse for him allows him to be able to be active in the community and allows me to be able to work. And so without that support right now, it's been a real challenge for us. There are times where he will call me. He's on a Medicaid waiver called TA waiver. It is assistive technology. And he will use his communication device to tell his Alexa to call me when he is in trouble. So I'll have to leave work to go home and suction him, clear his airway. This is, it's problematic, it's dangerous for him. It is problematic. Thankfully, I have a job that is very understanding and allows me to leave when I need to. But our nurses and aides that we've had over the years, they work 2 or 3 jobs because there's no insurance. They are paid sick or leave time, and the jobs pay like $13 an hour. It's just a really high turnover, and now we're just not getting them at all. So they need the support.
Yeah, I mean, because that is one thing I've heard, at least for the past 2 years, is just the staffing issues everywhere. I mean, hospitals don't have enough nurses, hospitals don't have enough doctors. So what I think previous panel, and I think you mentioned as well that that it's at $13 an hour is the average wage. So what, with this increase in funding, what would be kind of the overall average salary after that? Do you have an idea?
It about $18 an hour.
It'd bring it up to 18 about, okay.
And training and standards also that need to be
in place.
Also.
Yeah.
And there's
So would this do anything for actually developing the workforce for, because it's increasing the funding, but I mean, I'm assuming that a lot of these agencies that provide sort of these direct support professionals are probably short-staffed right now as well. Would this provide any, development for, training more direct support professionals? Or would this be more just providing more compensation at the $18 range?
Yes, providing more training for them being employed.
Okay. So would the training go towards like higher ed institutions for, or would this be more at training within the centers or training through within the agency?
Training in
Either.
The bill's vague and like it does not explicitly spell out like how to get to the end point. The overarching goal would be to reduce institutionalization of people with disabilities and elderly people, because living in the community is not only the moral right thing to do. People with disabilities don't need to be segregated. We've kind of decided that as a society. But also living in the community costs less overall to the taxpayers and to our federal and state systems. So it's kind of like a symbiotic. You can reduce costs and improve outcomes and quality of life for the people with disabilities. And in this case, also improve quality of life for people with who work as the direct service providers. And you mentioned the shortage of nurses. I'm actually a registered nurse by training, and I've recently resigned from my job because my caregiving duties at home didn't allow me to work. And I'm a master's trained nurse. So I was working remotely, work. So right now you're not getting tax dollars from somebody right here.
Well, where were you at? Which hospital or which facility?
So the largest,
UAB?
the largest care provider in the state of Alabama, providing services, as you know, all the way down to the Gulf Coast, tertiary regional referral center.
Well, I've been, I've worked for a couple members that were pretty active in healthcare space. And like I said, over the last year, I've met plenty of nurses and doctors. So I appreciate for all that, you do. And I can't do the on the ground medical stuff. I, get a little sick at the sight of blood, so that wouldn't really work out. So I do this side, but yeah, would this actually help people with developmental disabilities? I think you mentioned assistive technology. Is there any assistive technology funding included in this as well?
Let me jump in
Well,
and help. Under the waiver,
depends
every
on the
state
waiver.
picks from a menu. Yes, it is, and the state decides what it will be and how much they're willing to spend on it. Most states usually say 15,000 every 5 years, and that can even include home modifications. So that's sort of a guideline, but every state decides how much it's going to put in. And to go to I'm just going to help out on the training. This would require the state to set standards for every provider. Not each provider could do their own. The state would put the curriculum out there, and that's part of what's in this bill that I think makes it strong.
Mm-hmm. Now,
And Ms. Rose, there's another component to enhancing the lives of the direct service providers is that if we have more qualified direct service providers who feel they are worthy, that their profession is worthy and valued, it's also going to help reduce the massive waiting list of persons, who need services. I personally know of a person with a disability who's been on the waiting list since 2005. And so this massive waiting list puts an undue burden on the family because
I think my audio just went out. Can you hear me? Hello?
For a minute there.
Okay, there, I hear y'all.
This unmuted real quick. No.
We're gonna do charade. Or I guess he's the one.
Okay. Can you hear us?
Yes, I can hear y'all. Can y'all hear
There
me?
we go. Okay. And you should still have the same video.
Yes.
Okay. Should.
And I'm going to ask the whatever.
I don't think Cece had.
So the big picture is looking at reducing overall expenditure and improving folks with disabilities and the people that care for them, as well as people that aren't related to them and care for them. Looking at like individual goals, the things that this bill that's right, lays out would allow him to achieve some of his personal goals. We can share. Oh, really good. Yeah, he said he wants to work, and currently in Alabama, there's not like public transportation as an example that would allow him to do that.
Right.
So he doesn't want to get a check every month. He wants to go out and contribute to society. And so the upfront expenditure here would pay off in the long run in a multitude of ways. If that makes sense.
Well, yeah. Well, yeah, I appreciate all y'all coming in and, giving, lobbying Congress a shot and, trying it out. It's like I said, don't be afraid to like talk about, how this would impact y'all. The man with the black hat, you did a very good job. I had, like I said, you did a very good job of talking about, your son and talking about how this would actually benefit you and how this would change, and that was memorable. That's something that stood out during the meeting. And then also like talking about your nursing background, that's definitely very, good to talk about. And, because especially like when, my boss hears UAB, he'll be like, oh yeah, we work well with them, like, stuff like that. So yeah, definitely talk about, sort of introduce yourself first, and go around the group, talk about where you're from. And then maybe like how she was talking about her son, maybe be like, my son or my daughter, my mother has a developmental disability and it's, I'm, and talk about, I'm working, but then, go around the circle and then go into the actual bill. Y'all did good. It was just right at the beginning. That's kind of like where, also, are y'all planning on doing, I think I mentioned this before, in-person meetings are always good. This is good for like a training, for sure. In-person meetings, especially after how many Zoom meetings I've been on and the technical difficulties that we can have, always, I know it can be a little harder to get up here to DC but also like even trying to meet with a member of Congress while they were back home in the district. That's also a good way of, trying to get a meeting and that not having to fly all the way up to DC. But, the perk is about coming up to DC and talking with members is that you can do both the House and Senate. So you can meet with your senators and your, your Congress. And then also like, don't be afraid. Like I said, a lot of y'all are from different parts of the state. Meet with every member that's in that state, because, that's, even if you're not in Mobile, my boss was born in Sylacauga, Alabama. So like, even though he wasn't born in Mobile, he might hear that and be like, oh, I was born there. Oh, I was just born, 15 minutes down the road. So yeah, definitely highlight where you're from. Also, I know this, you probably, if you were to meet in person, have kind of like a leave behind, like a piece of paper kind of with the ask and general summary of what the bill would do, how it would benefit you personally, or how it would benefit individuals with developmental disabilities. And one of the things that one of the other groups mentioned that enhancing the support leads to better outcomes. One thing I mentioned was, providing studies or providing a study that, highlights that. Just because if you have, if we were to increase this funding, it's going to lead to better outcomes. And we know that because this study right here indicates that if there's better support in home-based care and services, there's a 60% increase. And y'all were doing a good amount of that, especially with like,
Nick, I'm gonna have to stop for a minute. The other people coming in, and then you can get up on full screen and make some comments again for everybody.
Great,
here.
yeah.
Really appreciate it. Thank you to this group.
Thank you, Nick.
Thank you.
Thank you.
Thank you.
Thank you. Nice to meet you.
Just 1 second, Mr. Eric's gonna put you up on the projector.